21. Pharmacology. Agonist. Drug that binds and activates the receptor to trigger and enhance an intended response. Analgesics. Drugs that relieve pain without causing a loss of consciousness. Anaphylaxis. Condition of shock caused by hypersensitivity to a drug or other substance that results in life-threatening respiratory distress and vascular collapse. Anemia. Subnormal concentration of erythrocytes or hemoglobin in the blood. Anesthetics. Agents that reversibly depress neuronal function, producing loss of ability to perceive pain and or other sensations. Angina pectoris. Severe constricting pain in the chest, often radiating to the shoulder and down the arm, caused by ischemia, obstruction of blood supply, of the heart muscle, usually a result of coronary disease. Antagonist. Drug that binds to the receptor and completely or partially blocks the activation of a biological response. Anticholinergics. Drugs that block the passage of impulses through the parasympathetic nerves. Arrhythmias. Variations from the normal rhythm of the heartbeat. Atherosclerosis. Condition in which thickening of the wall of a blood vessel occurs because of the deposition of plaque, atheroma. Bronchodilators. Drugs that cause expansion of the lumina of the air passages of the lungs. Coagulation. Process of clot formation. Contraindications. Conditions that render the administration of some drug or some particular line of treatment improper or undesirable. Diabetes mellitus, DM. Primarily a disorder of carbohydrate, protein, and fat metabolism secondary to insufficient secretion of insulin or insulin resistance. Diabetic gastroparesis. Form of nerve damage that affects the stomach. Food does not move through the stomach in a normal way, resulting in vomiting, nausea, or bloating. Diabetic peripheral neuropathy. Disorder of the peripheral nervous system, a complication of diabetes. Diuretics. Drugs that promote the excretion of urine. Drug. Any substance that, when taken into a living organism, may modify one or more of its functions. Edema. Presence of abnormally large amounts of fluid in the tissues of the body. Gastroesophageal. Reflux disease, GERD, inflammation of the lower esophagus from regurgitation of acid gastric contents. Symptoms include heartburn. Generic. Name drug name that is usually descriptive of its chemical structure but is not protected as is a brand or trade name. Hematoma. Localized collection of blood in the tissue resulting from a break in the wall of the blood vessel. Hyperlipidemia. Elevations of plasmolipid concentration. Hypertension. Persistently high arterial blood pressure, usually exceeding 140 mm Hg systolic and 90 mm Hg diastolic. Idiosyncratic. Reaction response to a drug that is not normative per its intended action or side effects. Inhalant. Breathable chemical vapor that may cause systemic and local effects. Infiltration. Diffusion of fluid into a tissue, often used interchangeably with extravasation. Laxatives. Agents that promote evacuation of the bowel. Narrow therapeutic index drugs. Drugs for which small changes in dose or blood concentration can cause serious therapeutic changes and or adverse reactions. Microorganisms. Microscopic organisms such as bacteria or viruses. Opioids. Drugs, natural or synthetic, that have pain relief activity, example being morphine. Osteoporosis. Disease of bone that leads to an increased risk for fracture, bone mineral density is reduced, and bone microarchitecture is disrupted. Parenteral. Not through the gastrointestinal tract but by injection. Parkinson disease, PD. Degenerative neurologic disease of the brain that often impairs motor skills, speech, and other functions. Peristalsis. Waves of contraction that propel contents through the gastrointestinal tract. Pharmacist. Person who is licensed to prepare and dispense drugs. Pharmacokinetics. Study of the metabolism and action of drugs with particular emphasis on the time required for absorption, duration of action, distribution in the body, and method of excretion. Pharmacology. Study of drugs and their origin, nature, properties, and effects on living organisms. Physical dependence. State of adaptation exhibited by a withdrawal syndrome specific to a class of drugs and that may be produced by abrupt cessation, rapid dose reduction, or administration of an antagonist. Schizophrenia. Chronic mental disorder characterized by periods of hallucinations and paranoia. Shock. Condition characterized by profound hypotension and reduced tissue perfusion. Side effect. Consequence other than the one for which a drug is used. Therapeutic. Pertaining to the art of healing. Thromboembolic disorders. Conditions involving the partial or complete obstruction of a blood vessel. Tolerance. State of adaptation in response to drug exposure that results in a decrease of one or more of the drug's effects over time. Vasoconstrictors. Drugs that cause constriction of the blood vessels. Vasodilators. Drugs that cause dilatation of the blood vessels. A drug is any chemical substance that produces a biologic response in a living system. More specifically, a drug is a substance used as medicine to aid in the diagnosis, treatment, or prevention of disease. The same drug has at least 3 different names: 1. A chemical name, 2. A generic name, and 3. A trade name. The chemical name, which identifies the actual chemical structure of the drug. The generic name is the name given to the drug when it becomes commercially available. A brand name is the name given to a drug manufactured by a specific company. An example of the names currently used for a single drug follows. Chemical name, 2-diphenylmethoxy-N-dimethylethylamine. Generic name, diphenhydramine. Brand name, Benadryl. The PDR provides a drug summary listing the class, Drug Enforcement Agency class, drug description, common brand names, how the drug is supplied, dosage and indications, maximum dosage, dosing considerations, administration storage, contraindications precautions, adverse reactions, drug interactions, pregnancy and lactation, and mechanism of action. Drugs are also classified according to action or function. Drugs that have similar chemical actions are grouped into categories called drug families. Drugs that relieve pain are classified as analgesics, drugs used to treat high blood pressure are classified as antihypertensives, and drugs used to fight inflammation are classified as anti-inflammatories. According to federal laws, drugs are classified legally as either prescription, legend drugs, or non-prescription. Prescription drugs require an order by a legally authorized health practitioner who may be a physician assistant, nurse practitioner, or physician. Vitamins, supplements, and herbal remedies are classified as dietary supplements and by law are not classified as drugs and are therefore not controlled by the U.S. Food and Drug Administration. The dose form may determine the speed, or onset, of the drug's therapeutic effect. Some of the common dosage forms include tablets, capsules, inhalants, suppositories, solutions, suspensions, transdermal patches, creams, and ointments. A tablet is a powder or granulated drug that has been compressed into a solid hard disk. Tables vary in size, shape, weight, hardness, thickness, disintegration, and dissolution characteristics. Tablets are single-dose units that may be scored or grooved to facilitate division into halves or quarters. A tablet that is not scored should not be broken into smaller parts. Some tablets are coated with a substance that delays the dissolution of the tablet until it is in the small intestines rather than in the stomach, where it is normally dissolved. These so-called enteric-coated tablets are used for drugs that might irritate the stomach, such as aspirin, or for drugs destroyed by the acid in the stomach. A capsule is a dose form in which a powdered or liquid drug is contained in a gelatin shell. The gelatin shell dissolves in the stomach and releases its contents. Inhalants are used for their local effects in the treatment of asthma or chronic obstructive pulmonary disease. An inhalant allows high concentrations to be deposited in the respiratory mucosa and exert action by producing bronchodilation or reducing inflammation. A suppository is a dose form shaped for insertion into a body orifice such as the rectum, vagina, or urethra. A solution is a dose form in which one or more drugs are dissolved in a liquid carrier. Solutions are usually rapidly absorbed and may be administered orally or parenterally. A suspension is a dose form in which one or more drugs in small particles are suspended in a liquid carrier. Most suspensions are administered orally and should be shaken thoroughly just before administration. Suspensions should never be administered intravenously. A transdermal patch is a dose form that permits a drug to be applied on the skin surface, where it is absorbed into the bloodstream. Some of these patches contain aluminum or other metals in the backing of the patches. The metals in the patches can overheat during a magnetic resonance imaging scan and cause skin burns. Ointments and creams are semi-solid topical medications for the skin or mucous membranes. Federal Drug Scheduling System. Schedule 1 drugs. 1. The drug or other substance has a high potential for abuse. 2. The drug or other substance has no currently accepted medical use and treatment in the United States. 3. There is a lack of accepted safety for use of the drug or other substance under medical supervision. Examples: heroin, lysergic acid diethylamide, marijuana, cannabis, 3 and 4-methylenedioxymethamphetamine, ecstasy, methaqualone, and peyote. Schedule 2 drugs. 1. The drug or other substance has a high potential for abuse. 2. The drug or other substance has a currently accepted medical use and treatment in the United States or a currently accepted medical use with severe restrictions. 3. Abuse of the drug or other substances may lead to severe psychological or physical dependence. Examples: combination products with 15 mg of hydrocodone per dosage unit, Vicodin, cocaine, methamphetamine, methadone, hydromorphone, Dilaudid, meperidine, Demerol, oxycodone, OxyContin, fentanyl, Dexedrine, Adderall, and Ritalin. Schedule 3 drugs. 1. The drug or other substance has a potential for abuse less than the drugs or other substances in Schedules 1 and 2. 2. The drug or other substance has a currently accepted medical use and treatment in the United States. 3. Abuse of the drug or other substance may lead to moderate or low physical dependence or high psychological dependence. Example: products containing 90 mg of codeine per dosage unit, Tylenol with codeine, ketamine, anabolic steroids, testosterone. Schedule 4 drugs. 1. The drug or other substance has a low potential for abuse relative to the drugs or other substances in Schedule 3. 2. The drug or other substance has a currently accepted medical use and treatment in the United States. 3. Abuse of the drug or other substance may lead to limited physical dependence or psychological dependence relative to the drugs or other substances in Schedule 3. Example: Xanax, Soma, Darvon, Darvocet, Valium, Ativan, Talwin, Ambien, Tramadol. Schedule 5 drugs. 1. The drug or other substance has a low potential for abuse relative to the drugs or other substances in Schedule 4. 2. The drug or other substance has a currently accepted medical use and treatment in the United States. 3. Abuse of the drug or other substance may lead to limited physical dependence or psychological dependence relative to the drugs or other substances in Schedule 4. Example: cough preparations with 200 mg of codeine or per 100 ml, Robitussin AC, Lamitil, Modafen, Lyrica, Peripectoline. Analgesics include Tylenol, or acetaminophen. Anesthetics include Diprivan, or Propofol. Anti-anxiety drugs include Valium, or diazepam. Antiarrhythmics include Xylocaine, or lidocaine. Antibiotics include Amoxil, or amoxicillin. Anticholinergics include atropine. Anti-cancer agents include Platinol, or cisplatin. Anticoagulants include Coumadin, or warfarin, as well as heparin. Antidepressants include Prozac, or fluoxetine. Antidiabetics include glucophage, or metformin. Antiemetics include Zofran, or ondansetron. Antiepileptics include Depakote, or Divalpro X. Antiepileptics include Depakote, or Divalpro X. Antihistamines include Allegra, or fexofenadine, and Benadryl, or diphenhydramine. Antihyperlipidemics include Lipitor, or atorvastatin. Antihypertensives include Lopressor, or metoprolol tartrate. Anti-Parkinson agents include Mirapex, or Pramipexole. Antiplatelets include Plavix, or Clopidogrel, and aspirin. Antipsychotics include Abilify, or aripiprazole. Anti-ulcer drugs include Pepcid, or famotidine. A benzodiazepine antagonist is Romazicin, or flumazenil. Bronchodilators include adrenaline, or epinephrine. Anti-Alzheimer's drugs include Aricept, or Donepezil. Corticosteroids include Decadron, or dexamethasone. Diuretics include Lasix, or furosemide. Hormones include Premarin, which consists of conjugated estrogens. Laxatives include Dulcolax, or Bisacodyl. Hypnotics include Ambien, or Zolpidem. Mood stabilizers include Escalith/Lithobid, or lithium. Nonsteroidal anti-inflammatories include Celebrex, or Celecoxib, Motrin, or Ibuprofen, and Naproxen, or Naproxen. An opioid antagonist is Narcan, or Naloxone. Osteoporosis agents include Actonal, or Risdronate, and Fosamax, or Alendronate. Stimulants include Adderall, which is amphetamine salts. Thrombolytics include activase, or alteplase, and retivase, or reteplase. Vasoconstrictors include Levoft, or norepinephrine. Vasodilators include nitrostat, etc., or nitroglycerin and nitropres, or nitroprusside. Regarding herbal remedies, echinacea stimulates the immune system, but can cause hypersensitivity. Feverfew is an anti-inflammatory, eases migraine headaches, but can cause bleeding and flushing. Garlic is for cholesterol reduction, and it lowers blood pressure, but can cause bleeding and heartburn. Ginger is an antiemetic but can cause bleeding. Ginseng helps one to maintain normal function in time of stress, but can cause insomnia. Ginkgo biloba stimulates circulation and increases mental alertness but can cause bleeding. Kava is an anti-anxiety agent that promotes sleep, but can cause liver toxicity. Saw palmetto promotes prostate health but can cause headache and diarrhea. St. John's wort relieves depression but can cause photosensitivity. Valerian promotes sleep but can cause headache and drowsiness. Healthcare providers and patients can be at risk for adverse outcomes from mishandling medications. The Institute for Safe Medication Practices biannually issues targeted medication safety best practices for hospitals. Analgesics can be divided into two groups, the non-opioids, non-narcotic, and the opioids, narcotic. Health professionals are encouraged to use the word opioid or opioids rather than narcotic or narcotics. The FDA has changed the indications for extended release, ER, and long-acting, LA, opioid analgesics. The updated indication states the ERLA opioids should be used in the management of pain severe enough to require daily, around-the-clock, long-term treatment and for which alternative treatment options are inadequate. Whereas physical dependence and tolerance are common with long-term opioid use, addiction is not. Addiction is a chronic neurobiologic disease characterized by one or more of the following behaviors: impaired control over drug use, compulsive use, continued use despite harm, inappropriate use, and craving. Opioid drugs are considered agonists because they bind and activate the opioid receptor to trigger and enhance a physiological response. Non-opioid analgesics such as acetaminophen, N-acetyl para-aminophenol, Tylenol, are relatively safe drugs used in the treatment of mild to moderate pain. Anesthetics are agents that reversibly depress neuronal function, producing loss of ability to perceive pain and/or other sensations. Two types of anesthetic agents are general anesthetics and local anesthetics. General anesthetics can be divided into inhalation agents such as sevoflurane, Ulton, or intravenous agents such as propofol, Diprivan. They act as central nervous system, CNS, depressants by producing muscle relaxation and loss of consciousness. Local anesthetics such as mepivacaine, carbocaine, and lidocaine, xylocaine, block nerve conduction from an area of the body to the CNS. Improper use can lead to excessive absorption of drug and may cause life-threatening side effects such as irregular heartbeat, seizures, breathing difficulties, and even death. Anti-anemic drugs are used for the treatment of anemia. Anemia is a subnormal concentration of erythrocytes or hemoglobin in the blood. It may be due to iron, folic acid, or vitamin B12 deficiency. Ferromazetol, Ferraheme, is a parenteral iron product used for the treatment of iron deficiency anemia in adult patients with chronic kidney disease. As a superparamagnetic iron oxide, it may transiently affect magnetic resonance diagnostic imaging studies for up to 3 months after the last dose. Anti-anxiety agents, or anxiolytics, are drugs used in the treatment of anxiety. They act on the CNS to calm or relax the anxious patient. Diazepam, Valium, and lorazepam, Ativan, are benzodiazepines prescribed for the treatment of anxiety, muscle spasms, and seizures. They are also used in alcohol detoxification or to prevent seizures and other acute withdrawal reactions. Antiarrhythmics are drugs used to treat arrhythmias, which are variations from the normal rhythm of the heartbeat. The abnormal rhythm may occur in the atria, the upper chambers of the heart, or in the ventricles, the lower chambers of the heart. Amiodarone, Cordarone, is mainly used for ventricular arrhythmias. Amiodarone may cause adverse effects such as hypothyroidism and pulmonary fibrosis. Antibiotics or antimicrobials are drugs used to kill or inhibit the growth of microorganisms. An antibiotic that is effective against a large number of microorganisms is termed a broad-spectrum antibiotic. If it is effective against only a small number of microorganisms, it is termed a narrow-spectrum antibiotic. Allergic reactions to antibiotics are common and range from mild to severe or even fatal. The most common allergic reaction is to penicillin. Anti-cancer agents can be used in conjunction with surgery and radiation, as adjuvant therapy to treat metastasis, locally advanced cancers, metastatic tumors, and hematologic cancers, for example, leukemia and lymphoma. Anti-cancer agents are also known as antineoplastic drugs and can be divided into two categories: cytotoxic agents and immunotherapy agents. Traditional cytotoxic agents are typically referred to as chemotherapy drugs. Immunotherapy agents include cancer drugs that trigger the body's immune system to fight cancer cells and enhance tumor immunity. Depending on cancer type, these drugs can be administered as single or combination therapy. Bone marrow suppression, alopecia, and nausea and vomiting are common drug side effects. Cytotoxic agents should be handled with precaution due to their toxicity. Anticholinergics are drugs that reduce smooth muscle tone, motility of the gastrointestinal, GI, tract, and secretions from respiratory tract and secretory glands. Oxybutynin, Ditropan XL, and tolterodine, Detrol LA, are two commonly used anticholinergics in the treatment of overactive bladder. Atropine is used preoperatively to inhibit the secretions that can be stimulated by general anesthetics and to prevent bradycardia, slowing of the heart, that may result from general anesthesia. The most common side effect of an anticholinergic agent is a dry mouth, but high doses of these drugs can produce serious side effects such as delirium, especially in the older patient, rapid heartbeat, and coma. Many other drugs can have anticholinergic side effects, such as diphenhydramine, Benadryl. Anticoagulants are drugs that inhibit clotting of the blood or increase the coagulation time. They are used primarily to prevent or treat thromboembolic disorders. There are several oral anticoagulants. Warfarin, Coumadin, is an example of an oral anticoagulant and a narrow therapeutic index drug. Slight change in warfarin dosing can cause adverse effects, including fatal bleeding, which can be reversed with phytonadione, Mufeton. New generation anticoagulants such as Eliquis, Apizaban, Pradaxa, Dabigatran, and Xarelto, Rivaroxaban, are not considered narrow therapeutic drugs. Antidepressants are drugs used in the treatment of depression. These drugs often require 6 to 12 weeks of administration to achieve their maximal therapeutic effect. The selective serotonin reuptake inhibitors are also used in the treatment of anxiety disorders, and Cymbalta is also used to treat diabetic peripheral neuropathy pain, generalized anxiety, fibromyalgia, chronic musculoskeletal pain resulting from chronic osteoarthritis pain, and chronic low back pain. Nausea, drowsiness, sexual dysfunction, and diarrhea are common side effects. Diabetes mellitus, DM, affects approximately 25.8 million Americans, 8.3% of the U.S. population. Diabetes mellitus is currently classified as type 1, in which insulin is absent, and type 2, in which insulin deficiency and insulin resistance exist. Insulin is the only treatment used to treat type 1 diabetes but is also used in the treatment for type 2 diabetes. Hypoglycemic, low glucose, reactions are the most common complication of antidiabetic agents. Metformin is associated with lactic acidosis, a rare adverse effect. Although rare, it has a mortality rate of approximately 50%. Antiemetics are drugs used to prevent and treat nausea and vomiting. Antiepileptic drugs or anticonvulsants are drugs used to prevent or control the occurrence of seizures. These drugs do not treat the cause of seizures, they reduce or eliminate seizure activity. Antifungal agents are substances that destroy or suppress the growth or multiplication of fungi. Fungal infections are more likely to occur in patients who are immunocompromised. Fungal infections can be divided into two major groups, those that affect the skin or mucosa and those that affect the whole body, systemic. Fungizone, amphotericin B, is usually the drug of choice for treating most serious systemic infections. It must be administered intravenously because it is poorly absorbed from the GI tract. Fungizone can cause a variety of adverse effects, such as chills, fever, and kidney damage. Antihistamines are drugs used primarily to treat allergic disorders, both acute and chronic. Antihistamines fall into two major groups, those that are sedating, first generation, and those that are non-sedating, second generation. Diphenhydramine, Benadryl, is a sedating antihistamine. Loratadine, Claritin, and fexofenadine, Allegra, are examples of non-sedating antihistamines. Hyperlipidemia is associated with the development of atherosclerosis, which leads to coronary heart disease, CHD. CHD remains the single largest killer of American men and women. Drugs called statins are usually the drugs of choice in the management of hyperlipidemia. Two common statins, atorvastatin, Lipitor, and simvastatin, Zocor, are used to treat hyperlipidemia. Liver abnormalities and muscle pain can occur. Antihypertensives are drugs used to treat hypertension, high blood pressure. Hypertension is a common disorder that affects approximately 77.9 million, 1 in every 3, American adults. Up to 4 different antihypertensive agents may be required to control hypertension. Besides lowering blood pressure, many antihypertensive agents are used in the management of other cardiovascular diseases. Angiotensin-converting enzyme inhibitors such as lisinopril, Zestril, and beta blockers such as metoprolol, Lopressor, Toprol XL, are used in the management of heart failure. A common adverse effect of angiotensin-converting enzyme inhibitors is a cough. Calcium channel blockers such as amlodipine, Norvasc, are used in the management of angina pectoris. Parkinson disease, PD, is characterized by a resting tremor, rigidity, inability to initiate movements, and bradykinesia, slowness of movement. Levodopa-carbidopa, Sinemate, is used in the management of PD and is administered orally. Common adverse effects associated with Sinemate are nausea and vomiting. Antiplatelet drugs are indicated in the prevention of myocardial infarction, MI, stroke, and transient ischemic attacks. Aspirin, clopidogrel, Plavix, ticagrelor, Brilinta, and prisugrel, Efient, are frequently used agents. The major complication for these drugs is bleeding. Antipsychotic drugs, neuroleptics, are used to treat psychiatric disorders such as schizophrenia, delusional disorders, acute mania, and agitated states. The antipsychotic agents are divided into 2 major groups, traditional antipsychotics and atypical, novel, antipsychotics. A well-known traditional antipsychotic is haloperidol, Haldol. A wide variety of adverse side effects, including sedation, orthostatic hypotension, and tremor disorder may be associated with both types of antipsychotic agents. Anti-ulcer agents are used to treat peptic ulcers, both gastric and duodenal, and gastroesophageal reflux disease, GERD. Pantoprazole, Prodonix, Famotidine, Pepcid, Lansoprazole, Prevacid, and Omeprazole, Prilosec, reduce the production of acid within the stomach. Unlike most antibiotics, antiviral agents do not destroy their target pathogen, instead, they inhibit its development. Antiviral agents are used to treat herpes simplex, chickenpox, shingles, influenza, flu, hepatitis, and infection with the human immunodeficiency virus, HIV. Acyclovir, Zovirix, is used in the treatment of genital herpes, chickenpox, and shingles and is available in oral, topical, and parenteral forms. Bronchodilators are drugs used in the treatment of asthma and chronic obstructive pulmonary disease. These drugs relax bronchial smooth muscles and dilate the respiratory passages. They can be classified as short-acting and LA bronchodilators. Albuterol, ProAir HFA, Ventolin HFA, is the most commonly used fast-acting bronchodilator. It is generally administered by inhalation but can be administered orally. Cholinesterase inhibitors increase the levels of acetylcholine, a major neurotransmitter in the CNS in Alzheimer's disease, AD. Concentrations of acetylcholine are reduced by 90%. Cholinesterase inhibitors such as Donepezil, Aricept, are used in the management of AD. The most common side effects are nausea, vomiting, and diarrhea. Coagulants are drugs used to control hemorrhage or to speed up coagulation. Most coagulants are commercial preparations of vitamin K, a fat-soluble vitamin needed for normal blood coagulation. Phytonadione, Mufeton, is a coagulant available in both oral and parenteral forms. Corticosteroids are drugs used to reduce the symptoms associated with chronic inflammatory disorders or for the short-term treatment of acute inflammatory conditions. Dexamethasone, Decadron, and hydrocortisone, Solocortef, are steroidal drugs used systemically, whereas methylprednisolone, Depomedrol, is generally injected locally at the inflammatory site, such as a joint or bursa. Diuretics are drugs that increase the amount of urine excreted by the kidneys, thus removing sodium and water from the body. Furosemide, Lasix, is a loop diuretic often used to treat the edema associated with congestive heart failure. Hydrochlorothiazide is a thiazide diuretic often used as monotherapy or in conjunction with other antihypertensive drugs for the treatment of high blood pressure. Patients receiving diuretics should be monitored for excessive fluid loss and electrolyte imbalance. Hormones are drugs that affect the endocrine system. The most important clinical application of these drugs is their use in replacement therapy, such as hypothyroidism. Levothyroxine, Synthroid, is used in the management of hypothyroidism. Levothyroxine is a narrow therapeutic index drug. Conjugated estrogen, Premarin, is a female hormone used in treating moderate to severe vasomotor symptoms, example night sweats, hot flashes, associated with menopause and to prevent osteoporosis. Laxatives are drugs that act to promote the passage and elimination of feces from the large intestines. Laxatives are frequently used in radiology to prepare patients for both GI procedures and urinary tract procedures. Laxatives such as bisacodyl, Dulcolax, magnesium citrate, and polyethylene glycol electrolyte solution, GOLYTELY, are used to eliminate all fecal matter, stool, from the colon so the physician will have a clear view of the intestinal wall. Mood-stabilizing drugs prevent mood swings in patients with manic depressive, bipolar, disorder. Lithium is one agent used in treating bipolar disorder. Polyuria, large volume of urine, tremor, and hypothyroidism, deficiency of thyroid function, are potential adverse effects. Nonsteroidal anti-inflammatory drugs, NSAIDs, have analgesic, antipyretic, fever-reducing, and anti-inflammatory actions. Most of the NSAIDs available are non-selective. All NSAIDs can cause GI irritation, peptic ulcers, GI bleeding, and acute renal failure, although Celebrex causes less GI bleeding and fewer peptic ulcers. Osteoporosis is characterized by a gradual reduction of bone mass and bone quality that weakens the bone and increases the risk for fractures. The bisphosphonates are considered the drug of choice for the treatment of osteoporosis. The bisphosphonates alendronate, Fosamax, and risdronate, Actonal, are commonly used and are administered orally. Some of their adverse effects include diarrhea, abdominal pain, and esophageal ulcers. The sedatives, or hypnotics, can produce varying degrees of CNS depression ranging from mild sedation to sleep. Zolpidem, Ambien, and esopicolone, Lunsta, are commonly used hypnotics. Extended use of these drugs can lead to physical dependence. CNS stimulants increase the activity of the brain and spinal cord. Amphetamine salts, Adderall, and methylphenidate, Ritalin, are examples of CNS stimulants used to treat attention deficit hyperactivity disorder. Dobutamine, Dobutrex, and dopamine, Intropin, stimulate the myocardium of the heart and are administered parenterally to treat conditions such as hypotension and shock. The thrombolytics drugs dissolve thrombi, clots, that have already formed. Alteplase, TPA, Activase, and Reteplase, Retavase, are common thrombolytics. The major adverse effect is bleeding complications. The vasoconstrictors drugs cause blood vessels to constrict, thus increasing heart action and raising blood pressure. Norepinephrine, Levoft, is a potent vasoconstrictor administered parenterally in the treatment of shock. This drug should be injected intravenously because infiltration can cause tissue necrosis. The vasodilators drugs cause blood vessels to dilate. They are useful in treating vascular disease, particularly angina. Nitroglycerin is an effective coronary vasodilator administered sublingually, orally, topically, or parenterally. The study of how a drug is absorbed into the body, circulates within the body, is changed by the body, and leaves the body is called pharmacokinetics. The following four basic factors influence the movement of a drug. Absorption, drug movement from its site of administration into the blood. Distribution, drug movement from the blood to various tissues and organs of the body. Metabolism, chemical alteration of various substances, drugs. The liver is the main organ involved in drug metabolism, taking a drug that is fat-soluble and turning it into a water-soluble substance so it can be eliminated from the body. Excretion, drug movement out of the body. The kidney is the most important organ for drug excretion. A drug's absorption rate is determined by how the drug is administered, the physicochemical properties, and formulation. Older adult patients, 65 years of age or older, may respond differently to drugs than younger patients because of decreased absorption, metabolism, and excretion. They generally require a reduction in dose. In addition, Children, especially in their first year of life, because of reduced capacity for the metabolism and excretion of drugs, will generally need a reduction in dose. An idiosyncratic reaction is a drug reaction that does not occur in most patients who have been treated with the drug and does not include the therapeutic effect of the drug. Essentially, it is impossible to determine who will have an idiosyncratic reaction to a drug. A side effect results from the drug acting on tissues other than those intended, which causes a response unrelated to the intended action. Toxic effects are adverse drug effects related to the dose of drug administered. Most drugs are capable of producing toxic effects if the therapeutic dose is greatly exceeded. Allergic reactions occur when the body's immunologic system is hypersensitive to the presence of the drug. Allergic reactions can occur only after repeated exposure to the specific drug or a chemically related compound. However, the radiologic and imaging science professional must remember that prior sensitization to the drug may have taken place without the knowledge of the patient. An allergic reaction may take one of two forms: immediate or delayed. Immediate reactions may range from a mild response such as hives to a severe life-threatening response such as anaphylaxis, which may include respiratory or circulatory collapse. Delayed reactions are usually less severe than immediate reactions and may not become evident for hours or even days after the drug has been administered. Emergency drugs commonly found on a crash cart might include the following: adenosine for cardiac arrhythmias, amiodarone for cardiac arrest, aspirin to inhibit platelet aggregation and for use as an analgesic, atropine sulfate, which is a beta blocker, Benadryl for allergic reactions, cardizem for cardiac dysrhythmias, dextrose to restore sugar levels, epinephrine for cardiac arrest and anaphylaxis, Lopressor, another beta blocker, Narcan for opioid overdoses, nitroglycerin spray for angina, Pronestil, procainamide, an antiarrhythmic, Solumedrol for allergic reactions. The American Society of Anesthesiologists has developed a continuum to describe the various levels of sedation. The sedation levels are as follows: minimal sedation, or anxiolysis; moderate sedation/analgesia, or conscious sedation; deep sedation/analgesia. Lastly, general anesthesia. Minimal sedation is a drug-induced state during which patients will respond normally to verbal commands. Cognitive function and coordination may be affected, but ventilation and cardiovascular function are unaffected. With moderate sedation, a drug-induced depression of consciousness occurs, but patients respond purposefully to verbal commands. This term has replaced the term conscious sedation. Ventilation is adequate and cardiovascular function is usually maintained. With deep sedation, a drug-induced depression of consciousness occurs during which patients cannot be easily aroused. They can respond purposefully after repeated or painful stimuli. Ventilation may be inadequate, but cardiovascular function is usually maintained. General anesthesia is a drug-induced loss of consciousness during which patients are not arousable even to painful stimuli. Ventilation is frequently inadequate, and cardiovascular function may be impaired. Because levels of sedation are along a continuum, predicting how a patient will respond is not always possible. Children, in particular, are prone to slip from one state to another with little warning.